Welcome to part two of our summary of frontotemporal dementia, where we look at symptoms and treatment. The symptoms of frontotemporal dementia or FTD can vary depending on the specific subtype of the disorder, but they generally fall into three main categories. The first is behavioral changes. This often includes alterations in personality and behavior, such as disinhibition, where the individual acts impulsively, disregards social norms, and engages in inappropriate behavior. Apathy, where the individual shows loss of interest or motivation in previously enjoyed activities. Social withdrawal, where they demonstrate reduced interest in social interaction and relationships. They may have changes in eating habits. They may overeat, stuff their mouth with food, putting them at risk of choking, demonstrate a preference for sugary foods, or develop cravings for unusual food combinations. They may also demonstrate lack of empathy, which is the reduced ability to understand or respond to the emotions of others. They may demonstrate repetitive, compulsive behaviors and also have very poor personal hygiene. Language difficulties are another category of symptom. These may manifest as speech problems, so difficulty finding words, speaking in a disjointed or nonsensical manner, producing grammatically incorrect sentences, or they may have complete loss of speech. They may also have word finding difficulties, so difficulty recalling words, selecting the correct word, or recalling names. They may demonstrate reduced comprehension, which will be about difficulty understanding the spoken and written language. Executive dysfunction refers to the difficulties with planning, organizing, and problem solving, as well as decision making, and this may lead to impaired judgment, making poor decisions, or engaging in risky behaviors, difficulty with multitasking or completing tasks, and inflexibility. They may demonstrate resistance to changes in routine or difficulty adapting to new situations, and anosognosia, which is lack of insight into one's own condition. The individual may be unaware of or deny changes in behavior or cognitive function. Other symptoms that may occur in individuals with FTD include motor symptoms such as muscle weakness, stiffness, or rigidity, as well as changes in coordination. The individual may also have tremor, muscle spasm, poor coordination, and difficulty swallowing. It is important to talk while we speak about symptom in FTD of FTD's relationship to motor neuron disease called MND or ALS, amyotrophic lateral sclerosis. These are two distinct neurological disorders, but they do have shared pathology and genetic factors. And where there is this overlap, it's called FTD MND or ALS FTD spectrum disorder. And the symptomology is going to be about changes in behavior, language difficulties, and progressive muscle weakness and wasting. Because of the overlap between FTD and MND, individuals with symptoms of one disorder may undergo evaluations for the other, and their care may involve a multidisciplinary team approach to address both the cognitive and the motor symptoms. While they are distinct conditions, their relationship shows us how complex neurodegenerative diseases are and how important it is to get a comprehensive assessment and have strong management strategies for the individuals who have overlapping symptom. Individuals living with frontotemporal dementia are prone to several medical complications that in part account for their shorter life expectancy, which we mentioned in part one. Difficulties with swallowing, chewing, moving around, and controlling their bladder and bowel leave them vulnerable to infections of the lungs, urinary tract, and skin. These infections can cause sepsis, which can become overwhelming and eventually lead to death. Treatment for frontotemporal dementia really focuses on managing symptom and providing supports to improve the quality of life. While there's no cure for FTD, various approaches can help. Certain medications may be prescribed to manage symptoms such as depression, agitation, or behavioral problems. However, these may not be as effective in FTD as they are in other types of dementia. Medications such as trazodone, which is an antidepressant, may help to reduce behavioral problems. Olanzapine is also used, although it's an antipsychotic, to help combat the same issues. Speech therapy can help manage language difficulties, while occupational and physical therapy can assist with daily activities and maintaining independence of the individual for as long as possible. Dementia care helps to create the right environment and establish routines that can help manage behavioral symptoms. Also, they support the caregiver and educate, which is essential in helping the caregiver to cope with the challenges of caring for someone with FTD. Lifestyle interventions such as regular physical exercise, maintaining a healthy diet, and staying socially and mentally active may help to improve overall well being and cognitive function, although we know they won't halt the progression of the disease. Neurologic consultations are also important. A neurologist is a medical specialist who deals with diseases of the nervous system, including the brain, spinal cord, and nerves. It's important for individuals with FTD and their caregivers to work closely with healthcare professionals to develop a comprehensive care plan that is tailored to their specific needs and challenges. Thank you for listening. Follow me on social media. On YouTube, I'm Deborah Calendar. On Instagram, I'm at Calendar Deborah. On Facebook, I'm Deborah Calendar Dementia Care Physiotherapy. On Twitter, I'm at Debbie CJ. On TikTok, I'm Deborah Calendar 4. On Threads, I'm Deborah Calendar. And on LinkedIn, I'm Deborah Calendar Dementia Care and Physiotherapy. Until next time, take care.